My name is Sam Carwyn, and I'm the Educator Advocate at Interfaith Alliance. We're going to be talking a little bit today about abstinence and protection and birth control. First off, abstinence is when someone makes a choice to not engage in sexual activity for a particular period of time. Abstinence can take place at any point. It does not have to be tied to before someone's engaged in sexual activity. You can choose to be abstinent after you've already engaged in sexual activity. And what you're being abstinent from is also a conversation that you can have with a partner, or if that's just a choice you're making for yourself, just being clear on what that looks like. It does require a lot of maturity and understanding of your whys. Some whys that people have are tied to their personal beliefs and values. Other people are concerned about protecting their health. They're just not interested in sexual activity at that point. They haven't found the right partner, or perhaps they're not in love with that individual. They would like to wait for someone they're in love with. They're in recovery, and for that period of time, they're not supposed to engage in sexual activity. They're trying to avoid pregnancy, STDs, and or HIV. Maybe they don't want to jeopardize their future goals and they're trying to stay focused on that. They're not ready to engage in sexual activity at a particular point in time, or they're just focusing on something else. So that could be school, that could be a new job. Regardless of someone's whys for abstinence, abstinence should always be supported by a partner and those around someone to help it be easier for them to maintain their abstinence for the period of time they're seeking. People often think of birth control as something that is solely taken to prevent pregnancy, but there are a variety of reasons why someone might use birth control that have nothing to do with pregnancy. Some of those might just be to regulate their menstrual cycle because they want to reduce their menstrual cramp pain. They're trying to get clearer skin, reduce their risk of cancer, prevent ovarian cysts. They're trying to minimize their PMS or PMDD symptoms. They're having endometriosis. They're trying to manage those symptoms. They're having menstrual migraines and they want relief from that. All of those are reasons why someone might use birth control. Also, birth control can be used by individuals who are in same-sex relationships. And I'll describe a little bit more later about what they might use it for. That's not necessarily birth control, but still protecting themselves from STDs. So as I'm talking about birth control and protection, I'm going to be talking a little bit about the effectiveness rate, which is not something you might have heard before. What it means is if something's taking exactly how it's supposed to, perfect use, that is how effective it is. But then there's the typical use rate, like how often are we actually using it as prescribed? So that's what we talk about as the typical use rate, just margin for mistakes and the reality of people being forgetful. What's right for you is the most important thing to think about when you're thinking about birth control. Birth control has changed over time to become more effective, but it's still medication. It's still something that you need to be talking to a provider about and recognizing that maybe some of the experience that had before you might be like yours, but it might not. You have to find the one that's right for you. Generally, with birth control, we're always encouraging people to use long-acting reversible contraception, also known as LARC. So the first few birth control options I'm going to go through are LARC, and I'll explain when I transition to a different type. So first one being an IUD. This is one that people hear about and has the longest rate. You can use it for up to 10 years. If you use the copper one, if you're using the hormonal one, that's anywhere from 3 to 5 years. Even though you can use it for that length of time, you can take it out at any point. It's just a small device. It's put inside the uterus by a healthcare provider. It makes it hard for sperm to enter the uterus, and it does release a small amount of hormones if you are doing the hormonal type. The interesting thing about the IUD, because there isn't really any user error, is it's 99% going to prevent pregnancy, and that's 99% what happens when you use it. So there isn't that same concern that there's user error there. It's long-term is the most important pro, and you don't have to remember to take it. The con is you do have to make a doctor's appointment to get it inserted and to get it removed. So implant, the arm implant is one that is the next longest period of time. You can have that in for up to 5 years. The same with that, because there's nothing that you as an individual are doing, it lasts for, it's 99% likely, has a 99% effectiveness rate, and that is the typical use rate as well because there's no user error. How does it work? It releases hormones slowly into the bloodstream. It helps prevent ovaries from releasing an egg, and it also makes the mucus thicker so it's harder for sperm to get into the uterus. It's really easy to check that it's there. That's one of the pros that a lot of people like. The only thing is that there is a delay, once again, in removal because you would have to go in and have a provider remove it for you. Depo is going to be the last of our LARC, so that long-acting reversible contraception. So it's a shot, it's an artificial hormone. A healthcare provider gives it to an individual every 3 months. Now, Depo is one that perfect use, you're at 99. It does drop down to 94. That's what the actual use is. People aren't always remembering to make those appointments at 3 months. So it's important to stay on top of that. It works the same as releasing eggs and thickening the mucus, so it's hard for sperm to get to. One of the things that is a big pro for Depo, it's easier to be private about your birth control, so other individuals aren't going to necessarily see that you're utilizing the shot, in particular the Depo shot. One of the cons people mention is that it increases your appetite. It's important to know that the Depo shot, like all birth control in and of itself, is not necessarily making people gain weight, but the hormone changes does increase some people's appetite, and that might cause some people to gain weight. One that's more common that people generally know about is the pill. So the pill has to be taken the same time every day. It's really important that you're doing it that same time. Hormones in the pill are stopping the ovaries from releasing eggs. Perfect use, we're at 99% effective. Typical, we're at about 91. Best pro is you can stop whenever you want. So you don't have to make an appointment with a provider. The only con is that you do have to make sure you're taking it at the same time every day. If you forget, there's some different things that providers will have you do, but take a glass of water and take it with you every day. So the patch, time-wise, is one that you keep on for 3 weeks and then you take a week off. Some providers will allow their patients to not take a week off, so you just keep it on. You might want to rotate where you're keeping it because some people will get some irritation from the glue on the patch if they're keeping it in the same spot. Generally, though, it's on the stomach, the upper arm, the breast is not recommended at all, but the upper torso, and you and your provider can talk about where on your body you would put that. We're at 99% effectiveness when used as directed, so to speak, and we're at 91 with actual typical use. It prevents ovulation. It's really simple and convenient. The only thing to be effective, to be mindful of, is that it's not as effective for individuals who are over around 200 pounds. The ring is soft, flexible ring. It has hormones in it as well. It's really important when you get the ring that you're storing it properly, that it's not being around any heat, because that's what actually helps the hormones release is the heat. So you keep it in for 3 weeks and then you take it out for 1 week and you have your period that week. If you're choosing to not have a period, which is perfectly healthy, then you would just make sure you have enough prescriptions that you wouldn't skip any weeks and you wouldn't have that week off. So one of the things about the ring is you can kind of just put it in and leave it for some weeks, which is nice. So it has a little bit more flexibility as far as how often you're utilizing it, and still a little bit longer than a daily or shot. So a little bit of flexibility. You have to be more comfortable with your body. So it's just something to be mindful of. And it's something you want to be mindful that you're remembering the days that you're putting it in and the days that you're taking it out and you're tracking that. External condom, we're at perfect use, 98% effective for preventing pregnancy, but generally we're at about 82. And I'll go through the steps because that's often why the rate is a little bit lower for effectiveness. So it's a thin sheath. It's made of latex or polyurethane or lambskin. It's a barrier, so it keeps sperm from entering into the uterus. There's no prescription. So you do have to plan ahead though. That's the one thing to be mindful of with that external condom, is that you're planning ahead. There are tons of different types of external condoms. Important part to think about is that you're picking one that's right for you. I was always taught that condoms are like jeans. All the brands fit a little bit different. So you have to find one that's going to fit you the way that you want and that's going to match you and your partner. So these are the steps for using a condom. One, always store it in a cool, dry place. You don't want to walk around with it in your pocket for too long or walk around it with it rubbing in your purse for too long. So being mindful that it's a cool, dry place and it's not rubbing up against other things. It's not getting too hot, especially with the heat wave we're having right now. First thing before you ever use a condom is you want to get consent from your partner. You're going to check the expiration date on the condom. You're going to check the package, make sure there's no rips or tears. You're going to open it carefully, not with your teeth, not with scissors. You don't want to accidentally rip it and then cause a hole in the condom itself. You can always squeeze it a little bit and check for that air bubble. That will let you know also that the package is in good shape. You're going to pinch the tip of the condom, and that's going to leave about 1/2 inch. That's just because when semen comes out, if semen does come out, then the rate and the speed with which it comes out can break the condom. So you're leaving that extra room just for that semen if that does happen. You're going to roll it down the base of a penis, or if you're using it with a toy, then you're going to roll it down the base of that, and I'll describe a little bit more about toys. And then you're going to engage in whatever action you and your partner have consented to engage in. Once that action is complete, you are going to make sure that you hold the base when you're removing it so it doesn't accidentally come off inside of a partner. So you're going to hold the base as you remove it and then slide it off to make sure that you're removing it properly. Tie it in a knot, throw it away, not in the toilet. You don't want to clog your toilet. That would be embarrassing. So condoms are great use with sex toys. So it can be used by anyone. You're going to put them on like you would anything else. You're going to make sure you're washing your sex toys in between as well. When you're using a condom, it provides a barrier. So you and your partner or you and your partners don't have to worry about transmitting any STDs. You're going to switch off the condom in between each individual person. It helps keep your toy cleaner. Another thing with using the external condoms on toys is it's going to sometimes have that lubrication, so that can help with individuals. Condoms can also be used as dental dams. So you would cut off the bottom ring and then cut the scissors straight up the middle, and then you'll be able to open it and use it as a dental dam for flavored condoms generally. That's when you would want to use those as a dental dam. You want to be mindful that you're never using a flavored condom for sex where something is being inserted into another person, because that can cause a yeast infection and some other difficulties. So though condoms often are referred to as if they're only being used for penis and vagina sex or anal sex, the reality of it is they can be used on toys, they can be used as dental dams, and they are a lot more accessible than some other products might be. So we talked a little about external condoms. More recently, internal condoms have come about, and they're also made of polyurethane. They're not made of latex, so they're great for people who have latex allergies. There's 2 rings on it, and I'll go through the steps in a minute. But one of the biggest pros about the internal condom, besides the fact that it's not made of latex, is that you actually can be started hours before activity. The use rate effectiveness is about 79%. So it's something people need more practice with to learn how to insert and use properly. So that the ring that is supposed to be on the outside is staying on the outside, and that smaller ring is staying on the inside of a partner. So these are the 4 steps that you're going to use when you are using an internal condom. The important thing is, like with the other condom, you are checking expiration date. So you're going to pull it out. You have that internal ring that you're going to pinch. You're going to use that to insert, whether that is for vaginal sex or anal sex. You can remove that inner ring if you'd like to for anal sex, but you do not have to. Once you insert the ring into your partner, you're going to make sure that outer ring stays on the outside of the body, so that way the whole thing isn't going inside of somebody. After sex, you're going to squeeze that ring and twist it. The outer ring's getting squeezed and twisted, so that way when you're removing it, nothing is coming out of the inside of the condom. It's really important with the internal condom that you're remembering, because it's lubricated and because it's polyurethane, it's a little bit more durable for sex, and also because of how it's made, it protects more of the skin to skin contact. So it reduces some skin to skin contact, which makes it better at preventing STDs if individuals are comfortable utilizing it. Fertility awareness is the last one that I would say is a preventative measure. So what it is you're abstaining during your most fertile days. You're assessing that by either your body temperature, you're assessing that by mucus, and you're using a calendar to learn what your fertile days are based off of your period. That's often called the rhythm method. A lot of individuals use that. The rhythm method, where you're solely just looking at the days of your period, is considered the least effective. But when you match it up with either checking mucus or body temperature, then it is a very effective way to learn about yourself and your own awareness of when you are fertile, and then abstaining those days that are considered your most fertile days. It is something that all faith traditions recognize as appropriate use of birth control, but it does require to be regulated, do a lot of tracking of writing everything down every day. So it can be a little difficult for people who don't have regular cycles, who aren't as good at staying on top of things. In reality, the best made plans, oftentimes there's still accidents happen, condoms break, you weren't as prepared as you wanted to be. So if that's the situation, there is emergency contraception. Emergency contraception is a pill that you take. It prevents you from getting pregnant. It will not stop you if you are already pregnant. It can only be used as a prevention measure. It's often called the morning after pill, but you can take it up to 5 days after you've engaged in sex. So it stops the ovaries from releasing eggs and it changes the lining of the uterus. It does affect your cycle a little bit. So it's something to be aware of. Depending on your body size and how long it's been since the unprotected sex, then you can talk to a provider. You might be able to get it over the counter. So just go to check in at a pharmacy and get it, but without a prescription, or you might have to get a prescription for it depending on your body size and how long it's been since the unprotected sex occurred. Most important thing to think about is, though we say it's birth control or it's protection, it's really about what is best for you and what you want to use it for. If you just want some acne relief, if you want to make sure that you're protecting your partner, so you want to, if you're using condoms and you want to use condoms over your fingers so you're not scratching a partner, all of those are things that you can use condoms and other birth control for. It does not solely mean for individuals who can get pregnant or who are trying to prevent pregnancy. Protection is for everyone.